1. What is the primary clinical manifestation of systemic lupus erythematosus, SLE? A. Joint pain. B. Butterfly-shaped rash. C. Shortness of breath. D. Weight gain. Answer: butterfly-shaped rash. Rationale: the butterfly-shaped rash across the nose and cheeks is a hallmark sign of SLE. Joint pain is common but not as specific to SLE as the rash. Shortness of breath and weight gain are not primary manifestations of SLE. 2. Which laboratory test is most commonly used to aid in the diagnosis of systemic lupus erythematosus, SLE? A. Complete blood count, CBC. B. Antinuclear antibody, ANA, test. C. B-type natriuretic peptide, BNP. D. Creatinine clearance test. Answer: antinuclear antibody, ANA, test. Rationale: the ANA test is highly sensitive and is a key diagnostic tool for SLE, detecting autoantibodies. A CBC is often used to assess general health, but is not specific to SLE. BNP measures heart failure and creatinine clearance assesses renal function, not lupus. 3. Which of the following medications is typically used to treat systemic lupus erythematosus flare-ups? A. Methotrexate. B. Hydroxychloroquine. C. Ibuprofen. D. Prednisone. Answer: prednisone. Rationale: prednisone, a corticosteroid, is commonly used during lupus flare-ups to reduce inflammation. Methotrexate is used for other autoimmune diseases, but is not first-line for SLE flare-ups. Hydroxychloroquine is a maintenance medication, while ibuprofen is for symptom control, not flare management. 4. Which organ is most commonly affected by lupus nephritis in patients with SLE? A. Heart. B. Lungs. C. Kidneys. D. Liver. Answer: kidneys. Rationale: lupus nephritis refers to kidney involvement in SLE and is one of the most serious complications. While SLE can affect the heart, lungs, and liver, renal involvement is the most common and potentially life-threatening. 5. Which of the following is a known risk factor for the development of systemic lupus erythematosus, SLE? A. Smoking. B. Male gender. C. Older age. D. Female gender. Answer: female gender. Rationale: SLE is more common in females, particularly those of childbearing age. Smoking may exacerbate the disease, but is not a primary risk factor, and SLE typically occurs in younger women rather than the elderly. 6. What is the primary pathophysiologic mechanism of systemic lupus erythematosus, SLE? A. Increased T-cell activity. B. Immune complex deposition. C. Hyperactivation of B cells. D. Inflammation of the synovial lining. Answer: immune complex deposition. Rationale: SLE is characterized by the formation of immune complexes that deposit in various tissues, triggering inflammation. T-cell activity and B-cell hyperactivation play roles, but are secondary to immune complex deposition. Synovial inflammation is common in SLE, but not the primary pathophysiologic mechanism. 7. Which of the following is a common early symptom of systemic lupus erythematosus? A. Butterfly-shaped rash. B. Severe weight loss. C. Difficulty swallowing. D. Severe headache. Answer: butterfly-shaped rash. Rationale: the butterfly-shaped rash is a hallmark early symptom of SLE. Weight loss, difficulty swallowing, and severe headaches are less specific and can be attributed to other conditions. 8. Which of the following lab results would be most suggestive of active lupus nephritis? A. High serum creatinine levels. B. Low white blood cell count. C. Decreased erythrocyte sedimentation rate, ESR. D. Negative anti-dsDNA antibodies. Answer: high serum creatinine levels. Rationale: elevated serum creatinine is an indicator of kidney dysfunction, which is commonly seen in lupus nephritis. A low white blood cell count is not typical of lupus nephritis. ESR may be elevated in active disease, and anti-dsDNA antibodies are often elevated during active lupus. 9. What is a common treatment option for managing mild to moderate flares of systemic lupus erythematosus, SLE? A. Nonsteroidal anti-inflammatory drugs, NSAIDs. B. Antimalarial medications. C. Chemotherapy drugs. D. Antibiotics. Answer: antimalarial medications. Rationale: antimalarial medications such as hydroxychloroquine are commonly used to manage mild to moderate SLE flares. NSAIDs may be used for symptom management, but are not disease-modifying. Chemotherapy and antibiotics are not first-line treatments for lupus flares. 10. What is the typical age of onset for systemic lupus erythematosus, SLE? A. 50 to 60 years. B. 20 to 40 years. C. 5 to 10 years. D. 60 to 70 years. Answer: 20 to 40 years. Rationale: SLE most commonly affects individuals between the ages of 20 and 40, particularly women of childbearing age. It is rare in children or older adults. 11. Which of the following is a potential cardiovascular complication of systemic lupus erythematosus, SLE? A. Myocardial infarction. B. Pericarditis. C. Aortic stenosis. D. Left-sided heart failure. Answer: pericarditis. Rationale: pericarditis is a known complication of SLE due to inflammation of the pericardium. While myocardial infarction can occur in SLE patients due to increased cardiovascular risks, pericarditis is a more common cardiovascular complication. Aortic stenosis and left-sided heart failure are less common in SLE. 12. Which of the following antibodies is most specific for diagnosing systemic lupus erythematosus, SLE? A. Anti-dsDNA. B. Anti-Smith. C. Anti-cardiolipin. D. Anti-SSA. Answer: anti-dsDNA. Rationale: anti-dsDNA antibodies are highly specific to SLE and are often used in diagnosis and monitoring disease activity. Anti-Smith is also specific, but less common. Anti-cardiolipin and anti-SSA antibodies are more commonly associated with other autoimmune disorders. 13. A patient with systemic lupus erythematosus is complaining of new-onset shortness of breath. Which of the following should be prioritized in the assessment? A. Pulmonary embolism. B. Pleuritis. C. Acute asthma attack. D. Pneumothorax. Answer: pleuritis. Rationale: pleuritis is a common complication in SLE, causing shortness of breath and pleuritic chest pain. Pulmonary embolism, asthma, and pneumothorax should also be considered, but pleuritis is the most likely cause in a patient with SLE. 14. What is the primary role of immunosuppressive medications in systemic lupus erythematosus, SLE? A. To reduce joint pain. B. To prevent organ damage. C. To treat infections. D. To promote wound healing. Answer: to prevent organ damage. Rationale: immunosuppressive medications are primarily used to reduce inflammation and prevent long-term organ damage in SLE. While they may help reduce joint pain, the main goal is to prevent damage to organs like the kidneys and heart. Immunosuppressives do not directly treat infections or promote wound healing. 15. Which of the following is a significant risk factor for the development of systemic lupus erythematosus, SLE? A. Obesity. B. Female gender. C. Lack of physical activity. D. Family history. Answer: female gender. Rationale: female gender is a significant risk factor, as SLE is much more common in women, particularly during reproductive years. Obesity, lack of physical activity, and family history may influence disease severity or contribute to comorbidities, but are not major risk factors. 16. Which of the following is a common non-pharmacological approach in managing systemic lupus erythematosus? A. Adequate rest. B. Drinking caffeinated beverages. C. Regular sun exposure. D. Alcohol consumption. Answer: adequate rest. Rationale: adequate rest is crucial in managing SLE, especially during flare-ups, as it helps reduce fatigue and inflammation. Caffeine and alcohol consumption may exacerbate symptoms, and sun exposure can trigger flares in patients with lupus. 17. A 28-year-old female patient diagnosed with SLE presents with a new rash. Which of the following nursing interventions is most appropriate? A. Encourage the use of sunscreen. B. Administer antimalarial drugs. C. Recommend increased physical activity. D. Advise the patient to avoid alcohol. Answer: encourage the use of sunscreen. Rationale: sun exposure can trigger flares in SLE patients, so advising the use of sunscreen is a priority. While antimalarials help manage the disease, sunscreen prevents rash exacerbations. Increased activity and alcohol use are not directly related to rash prevention. 18. Which of the following conditions is associated with a poor prognosis in patients with systemic lupus erythematosus? A. Renal involvement, lupus nephritis. B. Skin rashes. C. Joint pain. D. Mild fatigue. Answer: renal involvement, lupus nephritis. Rationale: lupus nephritis is a major complication of SLE and is associated with a poor prognosis, as it can lead to kidney failure. Skin rashes, joint pain, and mild fatigue are common symptoms, but do not indicate a poor prognosis. 19. Which of the following is the most appropriate initial assessment for a patient with suspected SLE? A. Full renal function test. B. Complete blood count, CBC. C. Urinalysis. D. Chest X-ray. Answer: complete blood count, CBC. Rationale: a CBC is commonly performed to check for anemia, leukopenia, or thrombocytopenia, which are often present in SLE. While renal function tests, urinalysis, and chest X-rays may also be needed, the CBC is typically part of the initial assessment. 20. Which of the following is a hallmark sign of systemic lupus erythematosus? A. Red, swollen joints. B. Butterfly-shaped rash. C. Generalized edema. D. Tachycardia. Answer: butterfly-shaped rash. Rationale: the butterfly-shaped rash across the nose and cheeks is a hallmark feature of SLE. While red, swollen joints can occur in SLE, they are not as specific to the disease. Edema and tachycardia are not primary hallmarks of lupus. 21. Which of the following laboratory tests is most commonly used to monitor disease activity in systemic lupus erythematosus, SLE? A. Anti-Smith antibody. B. Complement levels, C3, C4. C. Serum creatinine. D. Antihistone antibody. Answer: complement levels, C3, C4. Rationale: complement levels, C3 and C4, are commonly used to monitor disease activity in SLE, as they decrease during active disease due to immune complex deposition. Anti-Smith antibodies and antihistone antibodies are more specific, but less sensitive. Serum creatinine monitors kidney function, but not overall disease activity. 22. Which of the following is the primary purpose of corticosteroid therapy in SLE? A. To treat infections. B. To suppress immune system overactivity. C. To increase erythropoiesis. D. To prevent thrombosis. Answer: to suppress immune system overactivity. Rationale: corticosteroids are used primarily to suppress the overactive immune system in SLE. They help control inflammation and reduce the risk of organ damage. Corticosteroids do not treat infections, increase erythropoiesis, or prevent thrombosis directly. 23. Which of the following is a common neuropsychiatric manifestation of systemic lupus erythematosus, SLE? A. Stroke. B. Seizures. C. Dementia. D. Vertigo. Answer: seizures. Rationale: seizures are a common neuropsychiatric manifestation in SLE, occurring due to central nervous system (CNS) involvement. Stroke, dementia, and vertigo may occur in some cases, but seizures are more commonly associated with SLE. 24. What is the recommended vaccination for SLE patients before starting immunosuppressive therapy? A. Live attenuated influenza vaccine. B. Pneumococcal vaccine. C. Measles, mumps, rubella, MMR vaccine. D. Yellow fever vaccine. Answer: pneumococcal vaccine. Rationale: SLE patients on immunosuppressive therapy are at an increased risk for infections, so pneumococcal vaccination is recommended before starting therapy. Live vaccines, such as MMR or yellow fever, should be avoided in immunocompromised individuals. 25. A patient with systemic lupus erythematosus is prescribed hydroxychloroquine. Which of the following side effects should be monitored? A. Hearing loss. B. Retinal toxicity. C. Hyperkalemia. D. Hypotension. Answer: retinal toxicity. Rationale: hydroxychloroquine can cause retinal toxicity, which is why regular eye exams are recommended. Hearing loss, hyperkalemia, and hypotension are not common side effects of hydroxychloroquine. 26. Which of the following is the first-line treatment for mild to moderate SLE flare-ups? A. Methotrexate. B. Hydroxychloroquine. C. Prednisone. D. Cyclophosphamide. Answer: prednisone. Rationale: prednisone is the first-line treatment for managing mild to moderate SLE flare-ups due to its powerful anti-inflammatory effects. Hydroxychloroquine is used for long-term management, while methotrexate and cyclophosphamide are used in severe cases. 27. Which of the following symptoms is a sign of lupus nephritis in a patient with SLE? A. Hematuria. B. Erythema nodosum. C. Lichen planus. D. Keratoconjunctivitis. Answer: hematuria. Rationale: hematuria is a common sign of lupus nephritis, indicating kidney involvement in SLE. Erythema nodosum, lichen planus, and keratoconjunctivitis are not specific to lupus nephritis. 28. What is the most common cause of death in patients with systemic lupus erythematosus, SLE? A. Kidney failure. B. Heart disease. C. Infections. D. Stroke. Answer: infections. Rationale: infections are the most common cause of death in SLE patients, often due to immunosuppressive treatments. Kidney failure, heart disease, and stroke are significant causes of morbidity, but are less common causes of death. 29. Which of the following statements about systemic corticosteroids in SLE is true? A. They are always effective in treating lupus nephritis. B. Long-term use can lead to osteoporosis. C. They have no effect on the immune system. D. They should never be used in SLE. Answer: long-term use can lead to osteoporosis. Rationale: long-term use of corticosteroids in SLE can lead to osteoporosis due to their effect on calcium metabolism. They are not always effective for lupus nephritis, can suppress the immune system, and are an essential treatment option for SLE despite their side effects. 30. Which of the following is an important patient education point for someone diagnosed with SLE? A. Avoiding all forms of physical activity. B. Sun protection measures are important. C. Strictly following a high-protein diet. D. Avoiding vaccinations. Answer: sun protection measures are important. Rationale: sun exposure can trigger flares of SLE, so sun protection is crucial. While physical activity should be balanced and beneficial, a high-protein diet is not a necessary recommendation for SLE management, and vaccines are generally encouraged with precautions. 31. Which of the following medications can cause drug-induced lupus erythematosus still? A. Hydroxychloroquine. B. Methotrexate. C. Procainamide. D. Aspirin. Answer: procainamide. Rationale: procainamide, an antiarrhythmic, is known to cause drug-induced lupus erythematosus, DIL. Hydroxychloroquine, methotrexate, and aspirin are not associated with DIL. 32. What is the role of cyclophosphamide in the treatment of SLE? A. To treat mild arthritis. B. To treat severe kidney involvement, lupus nephritis. C. To reduce fatigue. D. To prevent skin rashes. Answer: to treat severe kidney involvement, lupus nephritis. Rationale: cyclophosphamide is used in severe cases of SLE, particularly for lupus nephritis, to suppress immune activity and prevent further kidney damage. It is not used for treating mild arthritis, fatigue, or skin rashes in SLE. 33. What is the best diagnostic test for detecting lupus nephritis? A. Urinalysis with proteinuria. B. Chest X-ray. C. Skin biopsy. D. Liver function tests. Answer: urinalysis with proteinuria. Rationale: urinalysis showing proteinuria is a key diagnostic indicator of lupus nephritis, as kidney damage often leads to leakage of proteins into the urine. Chest X-rays, skin biopsies, and liver function tests are not primary diagnostic tests for lupus nephritis. 34. Which of the following is a common clinical finding in patients with SLE-related arthritis? A. Symmetric joint involvement. B. Joint deformities. C. Morning stiffness lasting over 30 minutes. D. Osteophyte formation. Answer: symmetric joint involvement. Rationale: symmetric joint involvement is a common feature of SLE-related arthritis, often involving small joints, such as the hands and wrists. Joint deformities and osteophyte formation are not typical in SLE, and morning stiffness tends to last less than 30 minutes. 35. Which of the following is most likely to be found on a skin biopsy in a patient with SLE? A. Epidermal necrosis. B. Discoid rash with follicular plugging. C. Sebaceous cyst formation. D. Basal cell carcinoma. Answer: discoid rash with follicular plugging. Rationale: a skin biopsy of an SLE patient with a discoid rash typically shows follicular plugging and inflammation at the dermoepidermal junction. Epidermal necrosis and sebaceous cyst formation are not typical of SLE, and basal cell carcinoma is unrelated. 36. Which of the following is most commonly affected by lupus vasculitis? A. Small blood vessels. B. Large arteries. C. Capillaries. D. Venules. Answer: small blood vessels. Rationale: lupus vasculitis typically affects small blood vessels and can lead to tissue ischemia or necrosis. Large arteries, capillaries, and venules are less commonly involved in lupus-related vasculitis. 37. Which of the following is a typical cardiovascular complication in patients with systemic lupus erythematosus, SLE? A. Pericarditis. B. Hypertension due to dehydration. C. Aortic aneurysm rupture. D. Deep vein thrombosis. Answer: pericarditis. Rationale: pericarditis is a common cardiovascular complication in SLE due to inflammation of the pericardium. Hypertension, aortic aneurysm rupture, and deep vein thrombosis are less commonly associated with SLE. 38. Which of the following laboratory tests is most specific for diagnosing systemic lupus erythematosus, SLE? A. Antinuclear antibody, ANA. B. Anti-dsDNA. C. Erythrocyte sedimentation rate, ESR. D. C-reactive protein, CRP. Answer: anti-dsDNA. Rationale: anti-dsDNA is more specific for diagnosing SLE, especially in the context of active disease. ANA is commonly positive in SLE, but it is not specific. ESR and CRP are markers of inflammation but are not specific to SLE. 39. What is the goal of treatment for lupus nephritis in systemic lupus erythematosus, SLE? A. To prevent kidney transplant. B. To manage acute kidney failure. C. To reduce proteinuria and preserve renal function. D. To eliminate urinary tract infections. Answer: to reduce proteinuria and preserve renal function. Rationale: the goal of treatment in lupus nephritis is to reduce proteinuria and preserve renal function. Managing acute kidney failure is part of the treatment plan, but the primary goal is to prevent further damage. Kidney transplant and urinary tract infections are not the main focus. 40. What is the role of azathioprine in the management of systemic lupus erythematosus, SLE? A. To treat acute flare-ups. B. To suppress immune activity in severe cases. C. To reduce pain and inflammation in arthritis. D. To treat infections. Answer: to suppress immune activity in severe cases. Rationale: azathioprine is an immunosuppressive drug used in SLE to reduce immune system activity, especially in severe cases. It is not used for acute flare-ups or treating infections. It can help with reducing inflammation, but is not used as a first-line therapy for arthritis. 41. Which of the following is a common trigger for systemic lupus erythematosus, SLE, flares? A. Cold weather. B. Exposure to sunlight. C. Alcohol consumption. D. Overexertion. Answer: exposure to sunlight. Rationale: sun exposure is a well-known trigger for SLE flares, leading to skin rashes and disease exacerbation. Cold weather, alcohol, and overexertion can potentially worsen symptoms, but sun exposure is the most common trigger. 42. In a patient with systemic lupus erythematosus, SLE, Which of the following conditions is associated with an increased risk of thrombosis? A. Lupus anticoagulant. B. Rheumatoid factor. C. Hyperthyroidism. D. Hypertension. Answer: lupus anticoagulant. Rationale: lupus anticoagulant is a type of antiphospholipid antibody that increases the risk of thrombosis in SLE patients. Rheumatoid factor, hyperthyroidism, and hypertension are not directly associated with an increased risk of thrombosis in SLE. 43. Which of the following is a common ocular manifestation of systemic lupus erythematosus, SLE? A. Conjunctivitis. B. Retinal hemorrhage. C. Dry eyes, keratoconjunctivitis sicca. D. Glaucoma. Answer: dry eyes, keratoconjunctivitis sicca. Rationale: dry eyes, keratoconjunctivitis sicca are a common ocular manifestation of SLE associated with Sjogren's syndrome. Conjunctivitis, retinal hemorrhage, and glaucoma are less specific to SLE. 44. Which of the following non-pharmacological interventions is most important for a patient with systemic lupus erythematosus, SLE? A. Regular exercise to prevent weight gain. B. Vitamin D supplementation. C. Smoking cessation. D. High-protein diet. Answer: smoking cessation. Rationale: smoking cessation is crucial in SLE patients as smoking can exacerbate disease activity, especially pulmonary involvement. Regular exercise is important, but secondary and high-protein diets are not necessary for SLE management. Vitamin D supplementation should be considered, but is not the most critical. 45. Which of the following is most likely to be elevated during an active flare of systemic lupus erythematosus, SLE? A. White blood cell count. B. Blood glucose. C. Creatinine. D. Platelet count. Answer: white blood cell count. Rationale: a white blood cell count, WBC, can be elevated during active SLE flares due to inflammation and infection risk. Creatinine, blood glucose, and platelet count may be abnormal but are not typically elevated during active disease unless there is renal involvement or complications. 46. Which of the following immunosuppressive medications is associated with a risk of myelosuppression in patients with systemic lupus erythematosus, SLE? A. Hydroxychloroquine. B. Azathioprine. C. Methotrexate. D. Prednisone. Answer: azathioprine. Rationale: azathioprine can cause myelosuppression, a serious side effect that requires regular monitoring of blood counts. Hydroxychloroquine, methotrexate, and prednisone have different side effect profiles, with methotrexate potentially causing liver toxicity, but not myelosuppression like azathioprine. 47. Which of the following is the most common hematologic manifestation in systemic lupus erythematosus, SLE? A. Anemia. B. Polycythemia. C. Leukopenia. D. Thrombocytosis. Answer: anemia. Rationale: anemia is the most common hematologic manifestation in SLE, often due to chronic inflammation or autoimmune hemolysis. Leukopenia may also occur, but anemia is more prevalent. Polycythemia and thrombocytosis are rare in SLE. 48. Which of the following is a typical cutaneous manifestation in systemic lupus erythematosus, SLE? A. Discoid lupus erythematosus rash. B. Erythema nodosum. C. Psoriasis. D. Tinea corporis. Answer: discoid lupus erythematosus rash. Rationale: the discoid lupus erythematosus rash is a hallmark cutaneous manifestation of SLE, typically presenting as circular, red, scaly patches. Erythema nodosum, psoriasis, and tinea corporis are not characteristic of SLE. 49. Which of the following tests is most commonly used to monitor for disease progression in lupus nephritis? A. Urinalysis. B. Serum creatinine. C. 24-hour urine protein. D. Serum albumin. Answer: 24-hour urine protein. Rationale: monitoring 24-hour urine protein is a key test for assessing lupus nephritis progression, as it quantifies proteinuria, a sign of kidney damage. Urinalysis, serum creatinine, and serum albumin are also useful, but the 24-hour urine protein test is the most specific for lupus nephritis. 50. Which of the following is a key preventative measure for patients with systemic lupus erythematosus, SLE, to avoid flares? A. Limiting sun exposure. B. High-dose corticosteroid therapy. C. High-fat diet. D. Avoiding all physical activity. Answer: limiting sun exposure. Rationale: limiting sun exposure is a key preventative measure to avoid flares of SLE, as ultraviolet light can trigger skin rashes and disease exacerbation. High-dose corticosteroid therapy is not a preventative measure and can contribute to complications. High-fat diets and avoiding physical activity are not necessary. 51. A patient with systemic lupus erythematosus, SLE, presents with a butterfly-shaped rash across the cheeks and nose. Which of the following is the most likely diagnosis? A. Rosacea. B. Seborrheic dermatitis. C. Systemic lupus erythematosus. D. Psoriasis. Answer: systemic lupus erythematosus. Rationale: a butterfly-shaped rash across the cheeks and nose is characteristic of SLE, especially during active disease. Rosacea, seborrheic dermatitis, and psoriasis do not typically present with this distinctive rash. 52. What is the primary mechanism of tissue damage in systemic lupus erythematosus, SLE? A. Autoimmune destruction of tissues. B. Bacterial infections. C. Viral replication. D. Environmental toxins. Answer: autoimmune destruction of tissues. Rationale: in SLE, the primary mechanism of tissue damage is autoimmune destruction, where the immune system targets and damages various tissues, such as skin, kidneys, and joints. Bacterial infections, viral replication, and environmental toxins are not primary causes of tissue damage in SLE. 53. What is the role of hydroxychloroquine in the treatment of systemic lupus erythematosus, SLE? A. To reduce inflammation and control flares. B. To treat bacterial infections. C. To suppress the immune system. D. To decrease blood clotting. Answer: to reduce inflammation and control flares. Rationale: hydroxychloroquine is an antimalarial medication that is used to reduce inflammation and control flares in SLE. It does not treat infections or decrease blood clotting. It also does not suppress the immune system as much as other immunosuppressive medications. 54. Which of the following statements about systemic lupus erythematosus, SLE, in pregnancy is true? A. SLE can lead to an increased risk of miscarriage. B. SLE has no effect on pregnancy outcomes. C. SLE decreases the likelihood of pregnancy complications. D. SLE patients should avoid pregnancy altogether. Answer: SLE can lead to an increased risk of miscarriage. Rationale: pregnancy in women with SLE carries an increased risk of miscarriage, preterm birth, and preeclampsia. However, with proper management, many women with SLE can have successful pregnancies. Avoiding pregnancy is not typically necessary unless there are severe disease manifestations. 55. What is the primary goal of corticosteroid therapy in systemic lupus erythematosus, SLE? A. To induce long-term remission. B. To suppress acute inflammation and control flares. C. To treat underlying infections. D. To prevent skin rashes. Answer: to suppress acute inflammation and control flares. Rationale: the primary goal of corticosteroid therapy in SLE is to suppress acute inflammation and control disease flares. Corticosteroids are not used for inducing long-term remission or treating infections. They also do not directly prevent skin rashes, but help manage active disease. 56. A patient with systemic lupus erythematosus, SLE, presents with new-onset hypertension. Which of the following should be evaluated next? A. Kidney function tests. B. Blood glucose levels. C. Serum calcium levels. D. Liver function tests. Answer: kidney function tests. Rationale: new-onset hypertension in an SLE patient can indicate renal involvement, particularly lupus nephritis. Kidney function tests, including serum creatinine and urine analysis, should be evaluated. Blood glucose, calcium, and liver function tests are not the first tests to evaluate in this scenario. 57. Which of the following is a common neurological manifestation of systemic lupus erythematosus, SLE? A. Seizures. B. Multiple sclerosis. C. Parkinson's disease. D. Alzheimer's disease. Answer: seizures. Rationale: seizures are a common neurological manifestation of SLE, occurring due to central nervous system involvement. Multiple sclerosis, Parkinson's disease, and Alzheimer's are not common manifestations in SLE. 58. A patient with systemic lupus erythematosus, SLE, is prescribed methotrexate. Which of the following should be monitored regularly during therapy? A. Liver function tests. B. Blood pressure. C. Serum glucose levels. D. Vitamin D levels. Answer: liver function tests. Rationale: methotrexate can cause liver toxicity, so liver function tests should be monitored regularly. Blood pressure, serum glucose levels, and vitamin D levels are not the primary focus during methotrexate therapy. 59. Which of the following is the most common cause of death in patients with systemic lupus erythematosus, SLE? A. Renal failure. B. Cardiac arrest. C. Infections. D. Pulmonary embolism. Answer: infections. Rationale: infections are the leading cause of death in SLE patients, primarily due to immunosuppressive treatments and the disease's impact on the immune system. Renal failure, cardiac arrest, and pulmonary embolism are also risks, but are less common causes of death. 60. Which of the following lifestyle modifications is most important for a patient with systemic lupus erythematosus, SLE? A. Regular sun protection. B. High-sodium diet. C. Excessive exercise. D. Sedentary lifestyle. Answer: regular sun protection. Rationale: regular sun protection is essential for patients with SLE, as ultraviolet light can trigger flares. High-sodium diets, excessive exercise, and a sedentary lifestyle are not recommended lifestyle modifications for SLE patients. 61. What is the main reason that patients with systemic lupus erythematosus, SLE, are at increased risk for cardiovascular disease? A. Chronic inflammation and atherosclerosis. B. High levels of high-density lipoprotein, HDL. C. High blood pressure from medications. D. Poor diet choices. Answer: chronic inflammation and atherosclerosis. Rationale: chronic inflammation and the accelerated atherosclerosis associated with SLE increase the risk for cardiovascular disease. High HDL, blood pressure from medications, and poor diet choices are contributing factors, but not the main reason for the increased cardiovascular risk. 62. A patient with systemic lupus erythematosus, SLE, presents with hematuria and proteinuria. Which of the following is the most likely diagnosis? A. Lupus nephritis. B. Urinary tract infection. C. Nephrolithiasis. D. Glomerulonephritis. Answer: lupus nephritis. Rationale: hematuria and proteinuria are common signs of lupus nephritis, a complication of SLE affecting the kidneys. Urinary tract infections, nephrolithiasis, and glomerulonephritis can present similarly, but are not as commonly associated with SLE. 63. Which of the following medications is used in the treatment of acute flares of systemic lupus erythematosus, SLE? A. Prednisone. B. Methotrexate. C. Azathioprine. D. Hydroxychloroquine. Answer: prednisone. Rationale: prednisone, a corticosteroid, is commonly used to treat acute flares of SLE by suppressing inflammation. Methotrexate, azathioprine, and hydroxychloroquine are used for long-term management, but are not typically used for acute flares. 64. A patient with systemic lupus erythematosus, SLE, presents with a butterfly-shaped rash. Which of the following is the most appropriate initial management? A. Sun protection and topical corticosteroids. B. Oral antibiotics. C. Immediate corticosteroid infusion. D. Antihistamines for allergic reaction. Answer: sun protection and topical corticosteroids. Rationale: the butterfly-shaped rash is characteristic of SLE and should be managed initially with sun protection and topical corticosteroids. Antibiotics, corticosteroid infusion, and antihistamines are not appropriate first-line treatments. 65. What is the role of anti-dsDNA antibodies in the diagnosis of systemic lupus erythematosus, SLE? A. They are specific for lupus nephritis. B. They are used to monitor disease activity. C. They help in diagnosing rheumatoid arthritis. D. They are only present in severe SLE cases. Answer. They are used to monitor disease activity. Rationale. Anti-dsDNA antibodies are highly specific for SLE and are used to monitor disease activity, particularly in patients with renal involvement. They are not specific for lupus nephritis or other diseases like rheumatoid arthritis and can be present even in mild cases of SLE. 66. Which of the following is the most likely diagnosis in a patient with systemic lupus erythematosus, SLE, and pleuritic chest pain? A. Pleuritis. B. Pulmonary embolism. C. Pneumonia. D. Myocardial infarction. Answer. Pleuritis. Rationale. Pleuritic chest pain is a common manifestation of pleuritis, which can occur in SLE due to inflammation of the pleura. Pulmonary embolism, pneumonia, and myocardial infarction may also cause chest pain but are less likely in the context of SLE without other predisposing factors. 67. A patient with systemic lupus erythematosus, SLE, presents with mouth ulcers. Which of the following is the most likely cause? A. Autoimmune inflammation. B. Vitamin B12 deficiency. C. Oral infection. D. Medication side effect. Answer. Autoimmune inflammation. Rationale. Mouth ulcers and SLE are often a result of autoimmune inflammation, a common manifestation of the disease. Vitamin B12 deficiency and oral infections are less likely to be the cause in this context. Some medications may cause mouth ulcers, but autoimmune inflammation is the most common cause in SLE. 68. Which of the following laboratory findings is highly suggestive of active disease in systemic lupus erythematosus, SLE? A. Elevated serum creatinine. B. Negative antinuclear antibodies, ANA. C. Low white blood cell count. D. Elevated C-reactive protein, CRP. Answer. Elevated serum creatinine. Rationale. Elevated serum creatinine suggests renal involvement, which is a marker of active disease in SLE. Negative ANA and low white blood cell counts are not typical of active disease, and CRP is not typically elevated in SLE compared to other inflammatory conditions. 69. What is the primary clinical feature of lupus nephritis in patients with systemic lupus erythematosus, SLE? A. Proteinuria. B. Joint pain. C. Butterfly-shaped rash. D. Photosensitivity. Answer. Proteinuria. Rationale. Proteinuria is the primary clinical feature of lupus nephritis, indicating kidney involvement. Joint pain, a butterfly-shaped rash, and photosensitivity are common SLE symptoms but are not specifically indicative of lupus nephritis. 70. Which of the following is a potential complication of long-term corticosteroid therapy in systemic lupus erythematosus, SLE? A. Osteoporosis. B. Acute renal failure. C. Pulmonary fibrosis. D. Vision loss. Answer. Osteoporosis. Rationale. Long-term corticosteroid use can lead to osteoporosis due to decreased bone density. Acute renal failure, pulmonary fibrosis, and vision loss are not direct complications of corticosteroid therapy in SLE. 71. What is the primary function of belimumab in the treatment of systemic lupus erythematosus, SLE? A. To suppress the immune system. B. To inhibit B-cell activation. C. To reduce inflammation. D. To increase white blood cell count. Answer. To inhibit B-cell activation. Rationale. Belimumab is a monoclonal antibody that inhibits B-cell activation, which plays a key role in SLE pathogenesis. It does not directly suppress the immune system, reduce inflammation, or increase white blood cell counts. 72. Which of the following is the most appropriate first-line treatment for an acute flare of systemic lupus erythematosus, SLE? A. Hydroxychloroquine. B. Prednisone. C. Methotrexate. D. Azathioprine. Answer. Prednisone. Rationale. Prednisone, a corticosteroid, is the first-line treatment for acute flares of SLE due to its powerful anti-inflammatory effects. Hydroxychloroquine, methotrexate, and azathioprine are used for maintenance therapy, but are not used for acute flares. 73. Which of the following antibodies is most specific for diagnosing systemic lupus erythematosus, SLE? A. Anti-double-stranded DNA, anti-dsDNA. B. Anticyclic citrullonated peptide, anti-CCP. C. Rheumatoid factor, RF. D. Anti-Smith, SM, antibodies. Answer: anti-double-stranded DNA, anti-dsDNA. Rationale: anti-dsDNA is highly specific for SLE and is commonly used in diagnosing the disease. Anti-CCP and RF are associated with rheumatoid arthritis, while anti-Smith antibodies are also specific for SLE but are less commonly tested than anti-dsDNA. 74. Which of the following non-pharmacological interventions is essential for a patient with systemic lupus erythematosus, SLE? A. Sun protection. B. Low-fat diet. C. Vitamin D supplementation. D. Bed rest. Answer: sun protection. Rationale: sun exposure can trigger or worsen SLE flares, so sun protection is essential. A low-fat diet, vitamin D supplementation, and bed rest are not essential interventions specific to SLE management, though they may be part of an overall health regimen. 75. Which of the following conditions is often associated with systemic lupus erythematosus, SLE, and increases the risk for cardiovascular disease? A. Hyperlipidemia. B. Anemia. C. Hypothyroidism. D. Osteoporosis. Answer: hyperlipidemia. Rationale: hyperlipidemia is commonly seen in SLE and increases the risk of cardiovascular disease. Anemia, hypothyroidism, and osteoporosis can occur in SLE but are not directly linked to cardiovascular disease risk in the same way. 76. Which of the following is a potential complication of lupus anticoagulant in patients with systemic lupus erythematosus, SLE? A. Increased risk of thrombosis. B. Increased risk of infection. C. Bleeding tendencies. D. Renal failure. Answer: increased risk of thrombosis. Rationale: lupus anticoagulant is associated with an increased risk of thrombosis, including deep vein thrombosis, DVT, and pulmonary embolism, PE. It does not increase the risk of infection, bleeding, or renal failure. 77. Which of the following is the most effective strategy for managing fatigue in patients with systemic lupus erythematosus, SLE? A. Regular exercise. B. Bed rest and sleep. C. Increased fluid intake. D. Corticosteroid therapy. Answer: regular exercise. Rationale: regular, moderate exercise can help manage fatigue in SLE by improving physical conditioning and mental health. Bed rest and sleep may exacerbate fatigue, and increased fluid intake is not a direct intervention for fatigue management. Corticosteroid therapy may treat active disease, but does not specifically address fatigue. 78. A 45-year-old woman with systemic lupus erythematosus, SLE, is diagnosed with lupus nephritis. Which of the following is a common treatment approach for lupus nephritis? A. Renal transplant. B. High-dose corticosteroids and immunosuppressive drugs. C. Diuretics and antihypertensive medications. D. Antibiotics and antivirals. Answer: high-dose corticosteroids and immunosuppressive drugs. Rationale: high-dose corticosteroids and immunosuppressive drugs, such as cyclophosphamide, are commonly used in the treatment of lupus nephritis. Renal transplant is considered an end-stage renal disease. Diuretics and antihypertensives may be part of supportive care, but are not the primary treatment. 79. Which of the following is an important vaccination recommendation for patients with systemic lupus erythematosus, SLE, on immunosuppressive therapy? A. Influenza vaccine. B. Live varicella vaccine. C. Yellow fever vaccine. D. MMR vaccine. Answer: influenza vaccine. Rationale: the influenza vaccine is recommended for patients with SLE, especially those on immunosuppressive therapy, as they are at increased risk for infections. Live vaccines like varicella are contraindicated in immunosuppressed patients due to the risk of infection. Yellow fever and MMR vaccines may also be contraindicated. 80. What is the primary purpose of renal biopsy in a patient with systemic lupus erythematosus, SLE, and suspected lupus nephritis? A. To assess the severity and type of kidney involvement. B. To initiate hemodialysis. C. To rule out infections. D. To monitor kidney function. Answer. To assess the severity and type of kidney involvement. Rationale. A renal biopsy is used to assess the severity and type of kidney involvement in lupus nephritis, guiding treatment decisions. It is not done to initiate hemodialysis, rule out infections, or monitor kidney function, although it can provide information about kidney damage.